Acute disseminated encephalomyelitis is a monophasic immune-mediated demyelinating disorder in, again, the central nervous system that happens after a viral infection or a vaccination. It's most common in children and young adults, and it leads to multifocal neurologic symptoms with encephalopathy. It's thought to also be due to molecular mimicry, kind of like Guillain-Barré, where the immune response and responds to non-self antigens like viral proteins and cross-reacts with myelin antigens. There's a lot of different triggers. I listed some of the viral infections, bacterial infections, and post-vaccinations relatively rare. ADEM is characterized by a perivenous inflammation and then demyelination in the brain, spinal cord, and optic nerves, and it involves both gray and white matter. The autoimmune reaction is triggered by an antigenic mimic, a part of the bacteria or virus that looked too close to our own cells. There's a T cell mediated response against the central nervous system myelin antigens like myelin basic protein, and periventricular or perivenular demyelination due to lymph cells and macrophages infiltrating around these small little veins or venules. Axon preservation is typical, although you could see axonal injury in severe cases, and there is an increase in permeability in the blood-brain barrier, which allows for immune cells to infiltrate. I've listed some of the risk factors below, and really it's recent infection would be your biggest risk. It can present either acutely or subacutely with neurologic symptoms that progress over hours to days, typically after a prodrome of fever, malaise, or upper respiratory symptoms. Encephalopathy is needed for diagnosis where there's altered level of consciousness and or behavioral changes. There are lots of neurologic deficits that could happen, ranging from hemiparesis to a palsy of the cranial nerve, to optic neuritis that's one or both sided, to even myelopathy in some cases. ADEM is monophasic and it's post-infectious and has synchronous lesions. Encephalopathy is the most prominent component, and that's uncommon in initial presentations of MS. Lesions are larger, poorly demarcated, and symmetrical, and it's more common in children and young adults. Or it's more common in children. MS is more common in young adults. Complications could include raised intracranial pressure, like cerebral edema, respiratory failure if there's brainstem involvement, or even long-term neurologic sequelae, especially in a severe or a delayed diagnostic case. Many do recover fully. This is a favorable prognosis in most patients, especially kiddos. The recovery can begin within weeks to days. Mortality is really rare, and a small percentage could develop recurrent demyelinating diseases like a multiphasic ADEM or even MS, but that is rare. And that ends our lecture.